What is a donor site in reconstructive surgery? Imagine needing to repair a part of your skin after removing a skin cancer. To do that effectively, surgeons often need to borrow healthy tissue from somewhere else on your body. That area is called the donor site. It's the spot where tissue like skin, muscle, fat, or even bone is taken to help rebuild or cover the damaged area, which is known as the recipient site. In reconstructive surgery for skin cancer, removing the cancer often leaves a wound or defect that needs coverage. To restore both appearance and function, surgeons carefully select a donor site that provides suitable tissue. The goal is to choose an area that heals well, looks good, and minimizes visible scarring or loss of function. There are mainly two ways tissue is transferred from the donor site. The first is a skin graft, where only the top layer of skin is removed. This graft is completely detached from the donor site and placed on the wound. Since it does not have its own blood supply, it depends on the new site to grow blood vessels for survival. Common donor sites for skin grafts include the inner thigh or other less visible areas. The donor site usually heals on its own or with minimal stitches, but it needs proper care to prevent infection. The second method involves flap reconstructions. Flaps are larger pieces of tissue that include skin, fat, muscle, or even bone, along with their own blood vessels. Because they keep their blood supply, flaps tend to heal better and are more reliable. Flaps can be local, taken from nearby areas, regional, attached to specific blood vessels, or free, completely detached and reconnected to blood vessels at the recipient site using microsurgery. The choice depends on the size of the defect and the tissue needed. Choosing the right donor site is a careful process. Surgeons consider the type of tissue needed, the size and location of the defect, and aim to minimize visible scars or functional loss at the donor site. After tissue removal, the donor site heals through natural processes or with wound care similar to the recipient site. Proper management of both sites is essential for a good outcome, helping restore skin health, appearance, and function after skin cancer treatment. Always remember, each person's situation is unique. The best approach depends on individual factors, and a qualified surgeon can help determine the most suitable options. If you or someone you know is considering reconstructive surgery after skin cancer removal, consulting with a healthcare professional is the safest way to understand the best treatment plan tailored to your needs.